On today's Two on Your Side Town Hall, the biggest talk about story in Western New York right now. Should you be required to be vaccinated to go to a Bills or Sabres game when the stadium or the arena is full? We're going to continue that conversation looking at the science behind all of this.
Plus, you'll want to see our verified team's fact check that looks at blood clots when it comes to the vaccine and actually getting COVID. And
then later on, it is National Child Abuse Awareness Month. How the pandemic has impacted the fight to protect kids.
But first up today, New York State hit another vaccine milestone. Half of all adults have now received at least one dose of a coronavirus vaccine.
Yeah, today we also hit the mark of having a third of adults in the state being fully vaccinated. That's actually 3.5 percentage points better than the nationwide average.
Well, meanwhile, there's a lot of talk at the virtual water cooler today about that big announcement from Erie County that fans will have to prove they've been vaccinated before entering the Bills Stadium or the Sabres Arena when they get to full capacity.
Yeah, we've talked a lot over the past 24 hours about the political issues and the legal issues surrounding all of this. But what about the science? Think about it. If you're going to pack 71,000 fans into what is now Highmark Stadium, how much would it really help to have everybody vaccinated versus maybe the previous requirement of some people having a negative COVID test?
It is a great question to pose to our first guest on the town hall tonight, our pal Dr. Thomas Russo, joining us live. He is the chief of infectious diseases at UB's Medical School. We're glad to have you back with us, Dr. Russo.
Always great to be with you guys.
So again, for the audience here, we're not debating the legality of requiring vaccines. We're not talking about the politics of this. We really just want to kind of understand the science. So Dr. Russo, let me first ask you, how would you respond to people who say, look, I don't want to get the vaccine, at least not yet, but I will get a negative test. If that were allowed, could it be just as safe for everybody to go inside the arena or inside the stadium?
So whenever SARS-CoV-2, the virus that causes COVID, is circulating in the community, and undoubtedly in September, we'll still have some circulating virus, hopefully much lower levels than we have right now. Any event, whether it is indoors, outdoors, small or large, risk is minimized if everyone attending is vaccinated. And the reason for this is that if you're fully vaccinated, you're largely protected against getting infected and likewise being infectious and transmitting virus to others. A testing plan, albeit that was a nice touch pre-vaccination, is imperfect. And this is due to the fact that tests are not optimally sensitive and timing is critical. So for example, let's say someone is tested a day or two before the game, they're negative. Due to the fact that there's an incubation period for the virus, by kickoff, they may be infectious. And so that individual then could pose a risk to the other unvaccinated individuals that are attending. And albeit the risk is much, much lower if you're fully vaccinated, there may be a small group of people there that weren't assessed in the initial trials. Immunocompromised individuals and older, frailer adults were not assessed as well. And it's almost certain that vaccination will not afford quite the same high level of protection. So if someone wanted to bring their dad to the game, who's a bit older at this point and has been waiting their entire lifetime to see the Bills make that run that we're all hoping for, we'd obviously like to minimize that risk for that individual.
We want to ask you about one of the questions that we're hearing frequently. A lot of people have said that you shouldn't be able to require vaccinations because the 3 vaccines available right now are still offered under emergency use authorizations. Do you think that will still be the case for this fall for football games, or by then will these vaccines have that full FDA approval?
I think it's likely that the Pfizer vaccine will have full FDA approval. They've already finished and accumulated their 6-month safety data, which looks great. And so now they're in a position to apply for full licensure, and that would sort of put that legal question to bed. I think it's important to point out, though, regardless, and I know there's still significant vaccine hesitancy in our community and in this country, over 200 million doses have been given of the RNA vaccines, Pfizer and Moderna, with no safety signals of concern at all. And so these vaccines continue to look extraordinarily great. And not only will they afford protection for you as an individual, but obviously getting that critical number vaccinated is going to be great for our community and drive those cases down and let us get back to doing all those things we'd love to do.
Dr. Russo, we've also heard from people asking about bringing children to these football games or hockey games. I know Pfizer may soon ask for emergency use authorization for 12 to 15-year-olds. We saw the data come out there. It was 100% effective in one of the trials for that, but we don't know the specific timing of when that's going to happen. We do know that younger kids don't transmit the virus in the same way as adults, but how would you as an infectious disease expert kind of weigh the risks of allowing kids into the stadium or the arena, especially if they can't be vaccinated?
Yeah, I think, the same line of reasoning, albeit it's possible that younger children may be less efficient transmitters of disease. They still can transmit this virus. And so I'm pretty comfortable that based on the data that Pfizer's already generated that you alluded to, that there will be authorization for the 12 to 16-year-olds. And I think then they will have the opportunity to be vaccinated by the first game of the season. For children less than 12, those studies are ongoing right now, and it's a little unclear when that data will be available. And, if it looks good, which I anticipate it will, when there'll be authorization. So perhaps maybe for the not the first game of the season for those younger children, but hopefully for the December playoff run or deep into the playoffs.
Love your optimism.
Always optimistic. Dr. Russo, we're kind of wondering if this is something that you think might carry over to other large venues and events. Is the science strong enough that you think it's really, I think I may already know the answer to this given what you've said, but is this really the only safe way to have a bunch of people all together, close together, and looking farther ahead? If we reach herd immunity and the virus essentially dies off, how long until we may not have to even worry about proving we've been vaccinated in order to safely gather at big events? Is that something that we can even think about?
I think we can think about that, Kate. Certainly at this point, it is the safest way, because unfortunately, we still have a moderate burden of community disease, and we don't have the critical number of individuals vaccinated yet. And I think we'll know when we're there when our new cases go down to zero or very close to zero. I'm hoping that's going to occur with our continued vaccination efforts. And you guys brought some great news with that 50% and 33% number earlier, that we'll get there sometime in the summer. But, this is up to us here in Western New York. We have to step up and get it done. We have a great sense of community here, and people have to continue to realize that, yes, vaccination is about you, and it's important that you understand the benefits versus the risks, but it's also about protecting our community as well. I think we're going to get it done. We're not there yet, so let's keep going, Western New York.
Yeah, I mean, you talk about 33% of adults now are fully vaccinated across New York State. That means 2/3 aren't. So still a ways to go. Dr. Thomas Russo is Chief of Infectious Diseases at UB's Medical School and a friend of the show. Thanks so much for sharing some of your evening with us.
Yeah, my pleasure.
Thanks again, Dr. Russo. And ever since yesterday's news about Johnson & Johnson, the Verify team has been just flooded with questions about the recommended pause due to the potential risk of what is a very rare blood clot.
Yeah, it's only officially documented in 6 patients nationwide out of 7 million doses of vaccine. The CDC said today that headaches appear to be the main symptom for this.
And some people have argued that you're much more likely to get a serious blood clot from COVID than from the vaccine. So we asked Evan Kozloff to take a look into that.
A big announcement from the CDC and the FDA when they recommended pausing the Johnson & Johnson vaccine after 6 women developed blood clots after getting the shot. And look, there are a lot of statistics that are being thrown around right now, So we're going to dig into the numbers. Let's verify, are you more likely to see blood clotting if you have COVID than if you've gotten the Johnson & Johnson shot? Here are sources: the CDC, the FDA, and 2 Johns Hopkins University experts, Dr. Panagis Galiatsatos and Dr. William Moss. All our experts say that based on what we know right now, these risk factors are worlds apart. So far, only 6 women have been identified as having these CVST blood clots. That's out of almost 7 million Americans who have taken the Johnson & Johnson shot.
If that number 6 is all the cases, then we're talking about 1 in a million. It's possible that there are more cases that will turn up in the coming days.
Meanwhile, it's a completely different story for COVID cases.
The risk of blood clots is much higher, certainly in individuals who are hospitalized and have severe COVID.
The worse your COVID-19, right? So say that you're sick enough to land in an intensive care unit, probability of developing a blood clot's about 31%.
So that's about 3 in 10 versus 1 in a million. Our experts say it's going to come down to a risk analysis when people decide to get the vaccine. But Dr. Galiatsatos tells us that the risk is incredibly low.
It's always hard as human beings to kind of conceptualize when you hear a case, it sounds horrible, like your heart goes out. But recognize that case is very low. I always think of the analogy of planes, right? We hear plane crashes. But many of us still recognize that's a low probability. I'm still going to go out and fly.
So we could verify that based on what we know right now, the risk of blood clotting from COVID-19 is much higher than the risk from Johnson & Johnson vaccine. With your Verify, I'm Evan Kozlov.